Hello, my name is Kimberly Jones. I am going to talk to you today in regards to respiratory failure in a lung transplant patient. So some background. My patient is a 65-year-old white male with a history of pulmonary fibrosis. He lives at home with his wife. He is not currently working. Some other information about him, some past medical history. He has a history of interstitial lung disease, presence of cardiac pacemaker. He's had a history of pulmonary embolism, hypertension. He's had his gallbladder removed and a cabbage procedure performed. He is a past history of a smoker, but has not currently smoked for the last 20 years. He denies any alcohol use or drug use ever. So some history of his present illness. So he's got a history of pulmonary fibrosis, which has slowly been worsening, shortness of air over the last week, with unable to do his daily adult daily living activities. He underwent a bilateral lung transplant on January the 25th, 2018. Since then, he has presented in the clinic with complaining of cough, productive green-yellow sputum with a fever of 101.2 with some right-sided back pain times 1 week. So they worked him up, and they considered him to have status post lung transplant with septic shock with donor-associated MRSA, MRSA, pneumonia, and respiratory failure. So they did some workup and they did some blood work. So his labs, his white blood cell count was 13.2, hemoglobin was 8.6, hematocrit was 26.6, platelet count was 104. Calcium was 8.7. They did a chest x-ray. There was some coarse breath sounds, bilateral, mild use of the accessory muscles and respirations. His heart rhythms, S1 and S2, was normal. Abdomen, soft, non-tender. Extremities, he did have 2+ edema in his all extremities. They did so his vitals, his TC was 36.4, TF was 97.6, heart rate was 101, blood pressure was 144/75, fasting blood sugar was 160, respirations was 22, oxygen level was 97% on 2 liters nasal cannula. So the reason that he got the reason why he got septic shock was due to having the lung transplant on January the 25th. His donor did have some MRSA, so they treated him with vancomycin. Let's see, I have it written down somewhere. Okay. So, and they also did a bronchoscopy which showed wash from the donor site. It had MRSA on January the 29th. In which they treated with vancomycin, and then after that treatment, 2 weeks IV, that they treated the washing, they did another bronch, and it showed Pseudomonas on February the 12th. So they retreated with cefazolin. Some current medications that he's currently taking for this is Prograf, prednisone, low-dose Cellucep, Lasix, 100 milligrams every 12 hours, Tacrolimus, 0.5 milligrams every 12 hours. Mycophenolate, 250 milligrams every 12 hours as well. One of the other things I forgot to mention was on the chest x-ray, it did show a small right pleural effusion present because they had to put a chest tube in place to help him breathe better. And he did have some hazy opacities in the right lower lung base. On follow-up chest x-ray, it did show improvement from the beginning. So there was just mild, and then they took out the chest tube because it was healing properly. So some follow-up labs after that was his white blood cell count came down to 6.1. Hemoglobin count came up to 10.1. Hematocrit came up to 30.2. And chest x-ray showed improvements in the right lung base as well. And then also it showed in breast sounds was minimal crackles at the bases, which showed improvement, and he did not have any distress breathing. Follow-up vital signs was heart rate was 71, blood pressure was 136/82, fasting blood sugar was 120, respirations were down to 20, and then O2 was at 96% on room air. So he was able to go home and just do a follow-up bronchoscopy in 3 months. I believe that is it, and thank you very much.